Do you know what a normal period looks like? Let's talk without shame. Hi, I'm Dr. Swadha Kotpalliwar, obstetrician, gynecologist, and IVF specialist. If you have ever felt embarrassed or alone when your periods are late, painful, or you have missed your periods, you are not alone. Today, I'll share with you what is normal, what is not normal, and why knowing about your body is the first step towards loving it. A healthy menstrual cycle lasts between 21 to 35 days. That means if your period comes every month on the same time, give or take few days, then it is okay. Your bleeding should last for 2 to 7 days. Sometimes it can be lighter, sometimes it can be heavier. Occasional small clots can also be seen. PMS symptoms like mood swings, pain, or bloating can happen, but they should not knock you off your feet or force you to miss your work or school. Remember, your periods should not control your life, it should just be a part of it. When irregular cycles can be normal. A lot of patients who are in their teens or early 20s have irregular cycles. This can happen because of the immature hypothalamo-pituitary axis. And guess what? This is absolutely normal. On the other hand, women who are crossing their 40s can have their cycles sometimes shorter, longer, or they can have irregular periods. That is your body transitioning naturally. Short-term stress, exams, irregular eating habits can irregularize your cycle. But if this irregularity keeps on happening month after month, don't brush it aside. Visit your gynecologist. Here is when your period is telling you to pay attention. When you're soaking a pad or tampon every hour for several hours, it is heavy bleeding. Your period comes very often, frequently before 21 days, or if it is stretching more than 35 days. You miss periods for 2 to 3 months without being pregnant. Severe pain which wakes you up at night or forces you to pop painkiller isn't just a bad luck. Spotting or bleeding between periods, which is called as intermenstrual bleeding, needs attention. You have to visit your gynecologist if you experience either of these symptoms. These are times to check in with your gynecologist because you deserve answer, not anxiety. I once met a young woman, let us call her Priya. She had excruciating pain during her periods. Every month, she would miss her college, cancel her plans, and would always curl up with a hot water bottle. She blamed herself every time until we discovered that she had endometriosis. Today, with treatment, she is able to work, she is able to enjoy her life freely, and she is pain-free. Stories like Priya is why I'm passionate about talking it openly, because you should not suffer in silence. Painful periods aren't always normal. I want to spend an extra moment here because a lot of us feel that pain is just being a part of a woman, but that is not true. Conditions like endometriosis, where the endometrium which is supposed to be inside the uterus grows outside it, and this leads to painful defecation, painful intercourse, and painful periods. This can also lead to fertility problems. Polycystic ovarian syndrome, which is a very common problem these days, can lead to irregular periods, acne, hirsutism, and weight gain issues. Fibroids, a non-cancerous growth inside your uterus, can cause heavy bleeding, can cause pain in the lower part of your abdomen. So when your pain makes you dread your period every month, please don't ignore it. Might be your body is signaling you something very important. I grew up in India and I know a lot of us have heard things like you cannot shower during your periods, you cannot exercise when you get periods. Talking about periods is shameless. These ideas not only limit our freedom, but this makes us feel embarrassed about a normal body function. The truth, staying clean is healthy. Light exercises and yoga are actually going to help you with your period pain. And talking openly about it helps you take charge of your health. Here is what you can do right now. Start tracking your periods. Write about it in a notebook or an app. Write your last menstrual period. How long did the flow go on? How many pads did you change? Or any other symptoms associated with it. Eat iron-rich foods like green leafy vegetables, beetroot, jaggery to maintain your hemoglobin levels. Exercise regularly. It helps to keep your hormones balanced. If your cycles stay irregular for 2 to 3 months, please visit your gynecologist. We may do simple blood tests like some hormonal test or ultrasound to see what the underlying issue is. Remember, knowledge about your cycle is power. I have seen countless women blaming themselves, thinking that irregular periods or painful periods means that they are defective. But often these are medical issues which are not detected but can be easily treated. No one should feel shame for seeking help or for understanding their own body. You deserve care that is kind, thorough, and which is without judgment. Thank you for spending your time with me here today. Every woman deserves to understand her body and her cycle without shame. If you have learned something new, please subscribe and share this with your friends. I'm Dr. Swadha and I'm here to walk with you one step at a time.